Good morning. Good morning once again. We start from where we stopped in our last class. Rebecca, where is your tie? Please put on your tie, please. As long as you do not get one, button off properly. Okay, in our, is that what? All right, we are still on suppositories and pastries. We are still on suppositories and pastries. In our last class, we stopped at disadvantages, right? Right? Of what? Suppository, right? Is that where we stopped? Yeah. Okay, good. All right. You know, we said that suppository is a dosage form. Now, what are those characteristics that you will see in a dosage form? You will say that this particular dosage form is a suppository, not just a suppository. You can say, okay, this dosage form is this type of what? Suppository. Now, here, as I'm discussing the dosage form characteristics, at the same time, I'm pointing out different types of what? Suppositories we have. Am I communicating? So each type of suppository, I will point out the peculiar features that they will see. You say, okay, this is this type of what? Suppository. Am I communicating? So that's what we want to do now. Here we have different types of suppositories. We have your rectal suppositories. Rectal what? Suppository. That one in fact, that is what the name suppository in the present, in this era, has been subjected to. Whenever you mention, I think I mentioned it in our last class. Whenever you hear suppository, that's where our mind will do what? Go. But the actual name is what? Rectal suppository. Then we have our what? The next one is vaginal suppository. And that name is what? Pastries. Then you have your what? Urethral suppository. Urethral suppository. You can also call it bogies. Am I communicating? Bogies. That is urethral what? Suppository. From the name, you don't need to be told where they are used. Am I communicating? Where is urethra located? Womb. Who else? The diaphragm. Who else? Where is urethra? Where is where? What is the function of urethra? From where? What is the difference between urethra and urethra? What is the difference between urethra and urethra? Urethra and urethra. That's my marker. Urethra and what? Urethra. What is the difference between two of the good body? Comment. Where is this located and where is this located? Above where? Where? Which one is connected to the kidney? This one passes what? Urine from directly from where? Kidney down to where? Okay. Now, for males, where is the urethra located? All the brother. For males, where is the urethra located? Under the what? Kidney. This one. No. This is the one that the kidney is here. the kidneys. We have the kidneys, right? This one, there's this that leave the what kidney and enter the what bladder, right? They enter the bladder. From the bladder now, do you enter after blah blah blah? From here, something leaves the bladder through which urine can now go out of the body. That is what urethra. And this urethra for males, if you see the penis, is in between. Is that opening, the tube here? That's where the apart from urine, other things enter. All these graphia, sperm and what have you. But this is the urethra opening, penile opening. Yeah, come in. So urethra is from the kidney to the outside the body, right? But ureter from the kidney to the what? Urinary what? Bladder. Now, when you hear urethral suppository, at least you know where it should be what? Inserted. Am I communicating? That means it should be very, very what? Tiny. Very, very what? Tiny. Now, let's continue. Then you have another one. Nasal what? Suppository. Nasal what? Suppository. Or you call it nasal bougies. Or what? Buginaria. Am I communicating? Good. Then we have your what? Ear cones. Or simply ear what? Suppository. Or you call them what? Ear cone. They are also ear what? Suppository. Ear cones or what? Urinaria. Or urinaria. Am I communicating? Now, this is the one that are, but recently, the one that the most common here are what and what? And what? Now, let's go to the, having known these types of, these different types we have, we can now go down to the rectal suppository. Then for those, if you have seen missiles, bombs, how they look like. Have you ever bombs? Yes, missiles from the rocket now. You see how they look like. That shape is called torpedo what? Shape. That's the what? Torpedo what? Shape. So rectal suppository, they take that what? Shape. I mean, you see something like this. If you see all the missiles, it will be something like this. Am I communicating? Something like this. Torpedo what? Shape. Now, for adults, the adult one weighs around 2 what? Gram. 2 what? Gram. While the children, pediatric, weighs around 1 gram. Aga question. 2 gram and what? 1 gram. Now, for vagina, we mentioned 3 things here: the shape and the what? Weight for the adults and for the what? Children. 3 questions down already. Let's continue. Vagina suppository or what? Pessaries. Vagina suppository or what? Pessary. Remember striking features for vagina suppository. We are going down there now. I think I mentioned it in our last class or last 2, 3 classes. If you can remember, I will mention it again. The weight is around 3 to 5 what? Gram. 3 to what? 5 what? Gram. They are molded in globular or oviform. Oviform. Ova, right? Good. Globular or what? Oviform. Globular or oviform shape. Or compressed on a what? Tablet. Pressed in a conical shape. Remember I mentioned something before that recently. Most of them you see now are more of compressed what? Tablet. They disintegrate. Not melting. Am I communicating? Because they are compressed in tablet form. They do what? Disintegrate. Unlike suppository, unlike rectal one that they are no business with that disintegration. They are only to do what? Melt at the body what? Temperature. But this one, when it come in contact with the what? With the what? Vaginal what? Fluid. They will do what? Disintegrate. Am I communicating? That's for this what? Pessaries. That's why you see nystatin. If you didn't, what you see on the packet, for nystatin you see nystatin vagina tablet or insert. Most of them will just see vaginal tablet there with applicator. Put it in the applicator and do what? Insert it and push it in. It will enter. Am I communicating? Now that is for what? Vaginal what? Suppository or what? Pessaries. Now you have your what? Urethral suppositories. Or you call them what? Bogiles. They are a pencil what shape? They are formed in a pattern of the what? Urethra. Am I communicating? I told you that urethra is from the bladder. You now bladder to the what? Outside. Am I communicating? Now, they are molded in that what? Shape. That's why you see pencil what? Shape. For them to enter, they should be very what? Tiny. Pencil what? Shape. Now, those for males weighs what? 4 grams. For males weighs what? 4 grams. And they are about 100 to 150 millimeter what? Long. 100 to 150 millimeter what? Long. How many? What's the weight?
4 grams.
For males?
4 grams.
Good. For female,
2 grams.
For male? For what? Female is what?
2 grams.
2 grams. And
50 to 75
good. 60. What did this tell you? The length. Good. Male urethra is what? That what? Because male one extends to the outside. I'm not getting, but female one is more inside. You don't see it, right? Good. So that's an important point. This will help you to remember which one is. Once you remember that females urethra is shorter than males, so you should be able to know which and which is them. Am I communicating?
Yes.
Good. Let's continue. Now, for nasal suppository or what? Now they are meant to introduce with a nasal what? Cavity. Nasal what? Cavity. They are meant to be introduced to nasal what? Cavity. That's a striking point here. Unlike a rectal where you start anyway, most of the rectal, I think most of them are fatty base anyway. Fatty base. But here there's a point here. They are prepared with what? Glycerogelatin base. Who can tell me the reason? Who can tell me the reason? Let me know who that. Someone that thinks far. Who can tell me what do you think could be the reason? For this glycerogelatin base used in the what? Nasal suppository. No idea. No idea. You know, they can easily. When you hear glycero, it's not fatty. Hope you know. Glycero is not fatty. It's what? Liquid what? It's more water what? Soluble. When you hear glycerogelatin base, remember I told you that the base is more like vehicle. But if fatty base are not, they don't dissolve in what? Water. They can only melt at the body what? Temperature. But this one needs, when they come in contact with the mucous secretion on the what? Nose, they can easily do what? Melt. Sorry, do what? Dissolve. Am I getting? That's what they mean with what? Glycerogelatin base dissolved in when it comes in contact with fluid. Am I communicating? Glycerogelatin base dissolve when it comes in contact with what? Fluid. But fatty base don't dissolve. They can only melt at high what? Temperature. They can only melt at what? When I think I told you that the base, just like as we have in I think in your first semester you must have done something like that, vehicle and everything in medium where the ACPN that has the larger quantity, right? Like now, if you are preparing what paracetamol syrup, for example. Now I want to use liquid as an example, liquid dosage form as an example. Paracetamol syrup. You know that you prepare syrup itself. Syrup is about 6.67 sucrose in water. Once you have about 6.767 grams of sucrose sugar solution, get about 66.67 grams of sucrose. Sucrose is a sugar. Hope you know. When you get 6.7 grams of sucrose, dissolve it in water and make it up to what? 100 ml. That means you have prepared a what? a syrup. Am I committing? You have prepared a what? Syrup. Empty, just syrup. No active ingredient, just syrup. No other ingredient is there. Only syrup alone. Sucrose, about 6.7 grams. Dissolve it in a small amount of water and make it up to what? 100 ml. You have prepared a what? Syrup. Now, this syrup now is a vehicle. When you start, when you maybe even before you make it up to 100 ml or whatever, maybe depending on the volume you want to prepare at last. But this is on its own is a what? Syrup. Maybe you have to add another ingredient, maybe paracetamol or other ingredient, preservative you want to use to prepare the what? Liquid dosage form. You have prepared paracetamol what? Syrup. That paracetamol syrup, if the vehicle there is what? This syrup. Am I communicating? This will have or simply water, but it's more of what? You say what? Syrup. And it will take the consistency of the what? Syrup. You know what's consistency? How it appears. Am I communicating? That's why it will keep testing what? Sugar, because the vehicle is what? Good morning. I'm in class now. Okay. I'm in class now. Later. All right. Am I communicating? Now, the vehicle now is what? The syrup. That's why the paracetamol syrup will take the consistency of the what? Syrup. If you lick it, if you drink it, it will give you what? Sugar. You feel it that this is what? A syrup. And it will be thick. Because this will be thick. It will what? Thick. Because it's a high weight in 100 ml. It will be very thick. That's why syrup is what? Thick. It's not thick. It's thick, right? To compare with ordinary what? Ordinary, maybe adding ordinary sugar. Low amount in water. It will work thick. Now, this is the vehicle. The vehicle has the highest number of what? Quantity in a particular what? Dosage form. And that dosage form will take the consistency of that what? Syrup. Now, when it comes to ointments, suppository now, you don't say vehicle now, you say base. So sometimes the base you use may be wax. We call it fatty base. That's why that ointment or that suppository will be oily, will be in fatty form. It cannot dissolve. It will only melt. Just like I use candle wax as an example, right? Does candle wax dissolve in water? No. What can make it to go? No, take that time very well. Huh? You say what? In this class, you're not serious. Go outside. Don't distract us. Now, when you put candle in water, it cannot dissolve. The only thing that will make it to turn to liquid is what? High what? Temperature. Because of the nature, the waxy nature, it cannot dissolve in water. It can only melt at high temperature. Now, that's what because of the suppositories they put in the rectum. Most of them are in that waxy form. They only do what? They do melt at high temperature. Because as they enter the body, the anus to the rectum, the temperature there will be higher than what is happening in the what? Around the what? The room. So it will do what? Melt and release the what? Active what? Ingredients. Now, so whenever I mention base, understand it in this form. That base is what constitutes the consistency, what determines the consistency of the what? Dosage form. Now, I talked about the one for what? Nasal suppository. The base being glycerogelatin. Glycerol from where? Glycero. Combination of two words. Glycero what? Gelatin. Glycero from where? Glycerol. Gelatin. Both of them are soluble in what? Water. Am I communicating? They are soluble in what? Water. That's why remember I told you that what leads to fluidity of what? Soft gelatin capsule is what? Glycerol. Remember? Can you remember? Yes, we discussed. So now, I said that the one for what? Nasal, the nasal suppository, mainly blah blah blah. Was the fatty base, glycerogelatin base, the answer is what? Glycerol what? Gelatin what? Base. I say that you may see a question that say try to find out whether you actually now that the nasal suppositories the base for nasal suppository are mainly you see glycerol-gelatin base, fatty base, and other confusing options. If you're not careful, you just say none of the above. All right, let's continue. Now, these are important points. Remember, we are talking about the features of each of these suppositories. Now, they are prepared with what? Glycerol-gelatin base. They weigh about 1 gram. Weight is about what? 1 gram. The weight 9.10. Weight for now is what? 1 gram. Why the length is what? 9 to 10 cm. Weight is what? 1 gram. And length is what? 9 to 10 cm. Come in. I'm gonna tire a few now. Or if you sign in now, you're gonna have to stick. Make sure. Don't worry, after 3 p.m. you can remove it. Nobody will fight you after 3 p.m. Now, they weigh about 1 gram, and the length is what? 9 to 10 cm. Now, ear cones. Ear cones or what? Urinaria, right? Urinaria. They are meant to be introduced where? Good. They are rarely what? Used. Rarely. They are rarely what? Used. Now, you say, ask me, Nancy, how do you feel? It's not that comfortable. And apart from that, with time, remember the main thing in pharmaceutics, science of dosage form design. There's a branch of pharmacy we call what? Pharmaceutics. That's branch of pharmacy. What you study there, that people that specialize in that area, what you study there is science of dosage form design. And remember I told you that what leads to choice of dosage form or different dosage forms is nothing but to improve patient compliance. That's what leads to different dosage forms of different ones. Apart from that, also the physical property of the active ingredient, because there's an active ingredient that may not be in a particular, may not be comfortable in a particular dosage form. Apart from that, it has a lot to do with compliance. For some patients that may not be for compliance with a particular maybe injection, at least they can be compliant with tablet. True or false? Those that can comply with tablet, at least they can be compliant with the cream, right? Now, apart from that, that's another point that determines difference. So this is what they do in that area. So with time, it was like that before. It was popular before, but these days it's no longer popular as it used to be in those days. I'm not communicating. That's the point that we're trying to do. Do we now? The base for ear cone is what? Theobroma oil. Theobroma, or call it cocoa butter. Theobroma oil or cocoa butter. Yes. Theobroma oil or what? Cocoa butter. Am I communicating? Theobroma oil. That is the base for ear cone. What is the base for nasal suppository? What is it for nasal suppository? All right, is what? Glycerol-gelatin what? Now, let's go. Let's continue. You want to do what? Okay, you are the spokesperson. That's why I said that it's cocoa butter. Yes. That under name is what? Cocoa butter. Yes. And under name is what? Cocoa butter. You can call it cocoa butter or theobroma oil. Are we together? Now, so there's one striking thing about these ear cones. They are prepared as what? urethral what? Bulges. What are urethral bulges? Urethral what? Suppository, right? Then cuts according to what? Size. Am I getting? So that means what is it called again? That means urethra, suppositories, and ear cone are just the same thing. Am I getting? That's a very important point. I'm going to get a means in Jogi can do base for urethra suppository. So you will not give us that one in the handout. Learn how to link what IDS. I mean, look at this and decide to ask you the what is it called again, and decide to ask you the what, the base for what, urethral what, suppository. You start telling me, sir, but it's not in the material. You didn't teach us. But here now they're telling you that it's just the same process, the same thing. Just like maybe let's assume you are working in a firm, or maybe you are working in a lab, whatever firm, and you produce urethral. Let's assume you produce urethral suppositories. Then from there you can take some and cut it into different what sizes to suit the size of the ear code you want to do what use. Am I getting? That's the point they're trying to make here. So they have the same ingredient, the same thing. Are we together? The same base, everything. Are we together? Now, hello, one house, please. Kedife. Hello, one house, please. As you can see, you see different shapes of what? Suppository. Diameter, right? You see them. You have tampon, you have bullet, you have. There are different shapes there. And you see the mold. You see suppository mold. Have you seen it? The second slide. That you are seeing there is suppository mold. Mold is where you, after mixing, blending, you pour everything and allow you to take the shape of that mold. That was like mold. Can you see the mold? Some are metal, some are plastic. Can you see that? So after pouring it, they will take the shape of the what? Mold, depending on the shape you are looking for. Are we together? Are we together? So we call it, the name is what? Suppository mold. Okay. Why I think that they use the for rectal suppository. Maybe you see question that will be like trying to know whether you actually know how they prepare it. Anyway, we'll still talk about preparation anyway. Let me not be so fast. Mold. Mold is a mold, M-O-L-D. So we'll still discuss it when we go to preparation, okay? Now let's continue. So now let's talk about the therapeutic uses of what? Suppository. Of course, you don't be told that what it means is used in what? Active ones. Are we together? Do you agree with me that what it means, the what you use each one for? The therapeutic use for each of them is what? The active what? The activity of the what? Active ingredient there would determine the what? The therapeutic what? Use. Are we together? Are we together? So the activity of the action of the active ingredient is what determines the what? The therapeutic what? Use. Now let's continue. Remember, I told you that in our last class that suppository can be used for what? Local or systemic effect. I think I discussed at length what I mean by what? Local effect. And what I mean by what? Systemic effect. Any drug that has local effect, just concentrate on the where you apply the what? The drug. Am I communicating? Maybe in a no. You get diclofenac, for example, now rub here. Basically, it will just concentrate here. Am I communicating? But if you take the same diclofenac and do what? Drink the tablet. It's not local now. It enter the systemic system and through the blood and the exact maybe go to the pain center and do what other things you need to take care of the pain and what inflammation. But when you apply there, focus on what that area. That one has local effect. But the one you swallow, enter blood, go to different parts of the body, that one is what? Systemic what? effect. I think I explained that in our last class or last two classes. Now, so that suppository can be used for what? Local or what? System. It's not systematic. It's systemic. Local or what? Systemic. Local or what? Systemic. From what? System. Systemic. From where? System. System. So local effect or what? Systemic what? Effect. Now, remember I told you, the action depends on the nature of the what? Drug. Very important. Nature of the what? Drug. The action, the activity depends on the nature of the drug. Not only that anyway, but mainly on the nature of the what? Drug. Now, the concentration also and the rate of what? Absorption. Note at this point. The action, of course, the activity depends on the nature of the drug. What is the therapeutic effect of that drug? True of course. Then, when you now start talking about the extent on how it carry out the thing, the extent and you start talking about the what? The concentration and the what? Rate of what? Absorption. If the concentration that enters the system is poor, is low, than the therapeutic level that you exert effect, will the effect be strong? It will not. And if the rate of absorption is very, very low, that means the concentration that at a point that will take care of that, what you are treating may not be much, and it will still affect the what? The extent of the what? Action. But the action, if it is for pain, the pain is depend on the what? Whether it's that drug and whether it has an analgesic effect or not. True of course. So that's why I said that it depends on the what? One, the nature of the drug. Two, the concentration, and three, the what? Then when you go to nature, there are other things about the nature. You also talk about the physical chemical property of the drug. Don't worry, by the time we will go down there and dismantle them. So the action depends on the nature of the drug, concentration, and the rate of what? Absorption. Now, the next point I want to make here is that rectal suppositories are intended for what? Constipation and what? Hemorrhoids. I think I mentioned some drugs there. I mentioned, in constipation, I mentioned bisacodyl suppository, right? That is Ducolax. The generic name is what? Ducolax. Bisa. I mentioned Bisa. Bisa what? What is going on? Since I was start coming with my own matter. For constipation. Unu pacha kelafia indomie. Pacha biscuit, they grew. No food that will help for bowel movement. No fiber. No roughages of fiber. Refine these things. We never know with big gear. Kelafia. Soft drink na agaghị morning, afternoon, night. Atas sausage, atas biscuit, atas na onwe ezigbo n'ihe na-eri. Unu fue na ngado na na-amụ ya amụ. Hello. See, let me start with you. Let me start. My only fear na Gary is this. I have only two. Hello, I have only two reservations at Gary. One is this. How they preserve it. There are some people that if you go to where they put their Gary, they don't leave it. Rats and the family will be defecating on the Gary. And after you go and buy it and drink, it's risky because Lassa fever, the queer, is rare. So that's my only fear. And all that is things. But if I get my Gary on my own, process it by myself, store it very well. Store it very well. Me personally, I can confidently take Gary, add other things that will enrich me, and take it and be happy. I prefer it to all these junks who need. At least Gary has what? Fiber. At least it has fiber. Hello, let's continue, please. Hello. Now, hello. Now, this I told you what Bisa what? Bisa what? Good. Am I communicating? The brand name is what? The one that is popular is what? Ducolax. Can you see the board? This one is for what? Constipation. Hello? Bisa Codi. For what? Constipation. It's in suppository form. Those that have constipation, once you put it will enhance what? Bowel what? Movement. Are we together? Now, if constipation is not well managed and you are busy, you know that you are having issues defecating because of nonsense you are eating. Then you still go to the toilet and remain there. Continue. It's too much. Your anal sphincters. You call the one anal what? Sphincters. Your anal what? Sphincters will become weak. And if they become weak, hemorrhoids will do what? Ensue or pile. Am I communicating? They will do what? Ensue. So that's why once you have constipation, please know your diet. Then change your diet. There are some people that if they buy orange, do you know the part I enjoy more in orange? That roughly, that fiber anemia. And I don't joke with it. No, there are some people that once they take the liquid, they throw it away. Yes. When you ask them, they'll tell you, Abmoyago. Yeah, none the ago not there. I have been with people that confidently tell you, they are ignorantly, confidently tell you that none the ago not anemia. But without knowing the importance of that. Am I communicating? Now, some people don't take enough water. There's some that don't take water. They think using juice and water to eat food makes them big girls and big boys. They won't take what? Water. Continue. You see, You see, take water. Hello? Take water. Hello? Let me tell you what you do. Every morning, just boil water. Boil water. Every morning. Hello? Boil water. Allow it to cool a bit. Let it be warm. Drink it. But it's true. It's true. Take more of warm water. Hello? Now, eat food that has fiber. Yes. It's okay. Now, hemorrhoids. The popular one is anusol. Anusol, yeah. Yes. For what? Hemorrhoids. They put it also in the what? In the what? Hemorrhoids. Or simply what? Hemorrhoids. You can take it off anywhere. Pile. Anusol. Anu. From anus. Excuse me, give me like few minutes. I'm coming. Hello? Yes. Please. 1 hour, please. 1 hour, please. 1 hour. Please, let's conclude, please. I've given you some examples of one example each. I talked about hemorrhoids, right? Bile, and I talked about constipation, right? Now. Yes. Now, suppositories are also administered for systemic effects, just like in analgesics. Remember, in Alaska, I told something about diclofenac suppository in one of the classes. I think last class or last 2 classes. For what? Analgesic. Am I communicating? Then it can also be administered for antispasmodics, to take care of what? Spasm in the GI. Am I communicating? Spasm in the what? Uncontrolled what? Contraction and spasm. You don't know spasm. You don't know, child. Have you read this thing? Have you read this? You're not serious. You've read this. You didn't. I told people to don't see a word you don't know and pass it. It's wrong. So if you have read by now, you should have read this by now. If you have not read this thing, that means you already have started having issues already. You can do this at this extent by this time. You have already started having issues already. Understand it. Just understand it and be happy. Hello. If you have not read to this extent in this course by now, if you're going to be issue already, understand it first and be happy. If it's too much, use your words. You Google it. Yes. That is how to study. That is how to study. You cannot see in a you see a word you don't understand. What is it? Okay. Which sentence? Hey, give me one sentence. Give me one sentence. What did all the sentence? Hello? Word. Is it you don't understand? Is it and you don't understand? The only thing you won't understand here is what? Anti-spasm. And you do what? You use your word. Google. Period. Huh? Which jargon is that? Hey, she said that jargon. Which is an example?
Like, there are commona.
You do what? Google it. Which word? Trichomonal what? Infection, right? And you Google, hello, you Google trichomonal what? Infection. What's your test? You do what? You Google Monilla infection. Hello. Hello. If you can spend MBs watching TikTok, MBs, it runs in MBs and Gs. Hope you know. Each video you open runs in MBs and what? Gs. Obuluzi the KB. But yeah, how many KB that make 1 MB? 1,000 KB. Obuluzi Google where start here where we have problem. Even when you show radio, you strive, don't read and see a word and do what? Don't speak. Simple. Use your red pen. Hello. If you monilial hello, listen. If you see monilial infection, use your Google. Check monilial infection. Use your red pen. Write down the meaning in your words. Notebook. So you can remember the meaning. If you do what? Forget it. By the time you go through it, it becomes part of you. I'm giving you tips to get familiar to words you don't know the meaning. So hello. Without knowing the meaning of the word you are reading, you are the president of CAM. You are the president and secretary of CAM. Crammers Association of Nigeria. If you are reading a material and you see a word, hello, and you see a word you don't know the meaning, and you jump it, you are cramming. It's as simple as that. You must check the meaning, and that's when you will even appreciate what you are reading, and that's what you are reading will make sense to you. Try it today, and your life will not remain the same. So when you see hello, so I made mention of what? Hello, analgesic, antispasmodic, sedatives, and tranquilizers. Now let me ask you a question. Remember I told you that some patients that are mentally what? Disabled. You can use what? Suppository, right? Yeah. Now, for such patients, you can use sedatives and tranquilizers can be put in what? Suppository form for such what? Patient. Am I communicating? isi babido baka enyegoro ha tranquilizer and sedative ha eju ya lagoro lazigoro obele ike nọrọ nwayọ. Am I getting? That's why if you go to psychiatric hospitals, most of the drugs you see there are what? Most of the antipsychotic drugs, you start seeing sedatives, you start seeing tranquilizers that will stabilize them. Am I getting? Such drugs can be put in what? Put in form. But in here, they may not drink it. It what it just high aloe here. Aloe here, you will be hand on why you're not wool. And at what their brain are they going to come obele if you notice sometimes you see them they will just be quiet nolozia can they ka keke no jula for am I getting? That's one thing. So that's why you see tranquilizer there, you see what sedatives there. Are we together now? Okay he's already okay I'll stop here. Okay, before I go, just look at it. This diagram it just simplified it to tell you where you should not put the word suppository. If you put it too high, it will enter the systemic system. Especially if you want it for local action, it will not do the test. If you put it too low, it will do what? Drop off. If you put it at the middle, that's the right place to be. All right, thank you.
Thank you.